Friends, diabetes is a very common problem nowadays and it's one of the lifestyle diseases, and along with it a part of it is BPH. Amongst common lifestyle diseases we have diabetes, hypertension, heart disease, and benign prostatic enlargement is one of the part and parcel of metabolic syndrome. And most of these patients who have prostatic enlargement, it is either a genetic cause or it's part of aging process. Means 50% of men above 50 will be having BPH, above 60% will have above the age of 60, and 80% will have above the age of 80. Now comes that the comorbidities like diabetes, they adversely affect the problems associated with BPH, because common issues like frequency, urgency, and incontinence, they are symptom complex of BPH storage symptoms, but they are per se present even in patients who have diabetes. So managing diabetes along with BPH is a very important thing, and one has to understand that we as urologists, we have to accept the complications associated with diabetes, something like recurrent urinary tract infections and control of diabetes per se. So when we think of managing BPH, we have certain do's and don'ts. As far as do's are concerned, we have to control diabetes so that our HbA1c levels are 6 or less than 6. If our 3 months control is adequate, our medication for BPH works better. The other thing which precipitates diabetes is alcohol, lifestyle management, smoking, and they all have to be minimized. So when we talk of do's, we should restrict on use of alcohol, stop smoking, and lifestyle changes like regular exercises for control of blood sugar levels is mandatory. We should restrict fatty food also, because when there is a increased consumption of calories or fat, that also disturbs both BPH as well as diabetes. Certain don'ts as far as this is concerned, managing diabetes and BPH, it is important that we should avoid smoking, we should avoid alcohol, we should have a healthy lifestyle, strict control of blood sugar levels. That is important. And as I said, that sugar levels, fasting sugar should be less than 110. Coming to compliance levels, these patients who are having lifestyle diseases have a very strong pill burden. So if we have to restrict their pill burden, means we have to do compounding of medications. But the advice for patients with diabetes is that they should not take OTC tablets, because then it becomes complicated. So we must always guide our patients that they should be in consultation with the physician and the urologist, so that the pill burden is less